moving on to part 2 in our discussion of STI prevention and pregnancy prevention, we're going to talk about the different categories of STI prevention and contraception. Now, the reason that we're categorizing this way is it's kind of one of those A equals B, but B does not equal A. Pretty much any method that's going to prevent you from contracting an STI is also going to prevent pregnancy, but not all methods that prevent pregnancy prevent STI contraction. So that's why we need to discuss both, and not both of them are relevant to every person. So I'm going to try to be kind of inclusive in the considerations that we're discussing. So there's 6 main categories of contraception STI prevention. The first is barrier methods, and barrier methods are the only ones that are also going to protect against STIs. So there's barrier methods, there's hormonal methods, there's LARCs or long-acting reversible contraception, there's intravaginal methods, there's rhythm methods, and there's permanent methods. So we'll start with talking about barrier methods. Barrier methods include the external condom or the male condom, the internal condom or the female condom, and dental dams. Now, an external condom is the condom that everyone is familiar with, right? It's the condom that goes over the penis. It's your traditional Trojan condoms. Internal condoms, a lot of people don't actually know that these exist, and they're pretty hard to find, but they're larger and they fit inside the vaginal canal, and they actually have like not really a flap, but they have enough excess that it can cover the vulva region as well. So that can be very good if you have a situation where there's a concern about herpes, or if there is a concern about HPV, for example, since HPV can shed very easily through skin cells all around the vulvar area. So it has extra material that can cover the vulva area. So that can be great for STI prevention. And then there is dental dams. And dental dams is like a rectangle of latex that's meant to go over the vulva region for oral sex. Again, really good for preventing the transmission of HSV, gonorrhea, syphilis, chlamydia in the throat, things of that nature. Not everybody is familiar with dental dams. I can post a link to those in the comments as well, so you can see what they are and if they would be appropriate for your situation. Like I said, internal condoms are actually much harder to find, and I wasn't able to find any on Amazon that I could post a link to. Side note, if you are using a barrier method, if you are using an external condom, an internal condom, or a dental dam, you want to make sure you are only using water or silicone-based lubricants, because oils will weaken and will make them more likely to break. So a lot of people who are very interested in doing things naturally like to use like coconut oil or avocado oil or something like that as a lubricant, which is great. But if you do also have a concern where you're needing to use a barrier method, it significantly weakens it. So make sure you're using a water or a silicone-based lubricant, or something that's a water or silicone hybrid and not oil-based. And this is true whether you're using latex or non-latex condoms. It's the consideration is there for both of them. So again, barrier methods are the only ones that are going to prevent STIs. So these other ones are for pregnancy prevention specifically. None of these do squat in preventing STIs. You are not protected against STIs if this is all that you're using. So first, with hormonal methods. There are 5 main types of hormonal methods for contraception. There's the pill, which is a traditional birth control pill. There's the patch, which is a little rectangle you can put on your arm, on your butt, on your hip. You change it out once a week, and it provides a steady flow of hormones through the skin every week. Some people who have really sensitive skin have reported it irritating their skin and not really working well for that. There's the ring, which is this little like latexy silicone ring. It's about that big or so. And it fits inside the vaginal canal. And within that ring, it's hollowed out, but within that ring are hormones, so a similar hormonal profile to the birth control pill, and you keep them refrigerated. And then when you insert them, your body heat actually releases those hormones in a steady flow for 3 weeks. So you have 3 weeks of continuous protection. Switch it out. Pretty easy. With it being an actual object inside the vaginal canal, Some people report that they can feel it during penetrative sex. Others report that it's really not that noticeable. So it just kind of varies from couple to couple. The shot, the most common brand is Depo-Provera. That's a shot you get. It lasts for 3 months. So it's great because you don't really have to think about it. You go in once every 3 months and get a shot and you're done. The significant con of it is that if you're somebody who tends to be sensitive to medications, especially if you're sensitive to hormones, you get that shot and it's in there for 3 months. So if the hormonal profile of the shot is causing you to have migraines, causing you to have muscle cramps, causing you to have whatever else, you could theoretically end up with these same side effects for 3 months, because that's how long it's going to be in your body. There's no undo button. There is no antidote. So it's there. And the last one is emergency contraception, which we'll talk about more in a little bit. And that is a pill that is meant to be taken immediately following unprotected intercourse if there is a concern about pregnancy. It prevents pregnancy. It is not to be used as a regular basis. It's not something that's supposed to be taken every month. And it is not the same as an abortion pill, which is a very personal soapbox of mine. And I will ramble on about that here in just a little bit. The third category are LARCs, or long-acting reversible contraception. There's 2 key categories of these. There's Nexplanon, which is, it's about the size of a matchstick, about the size and shape of a matchstick, and they insert it in the upper arm, about right here, and it sits under the skin. And similarly to how the ring works, the body heat allows a steady flow of hormones to be released, and once every few months you go to the doctor and they swap it out. So it lasts for several months. You do not have to worry about it, and it's just kind of there. The benefit of the Nexplanon over the shot is that you can take it out. So if you're having hormonal side effects, it can be removed. And then finally, the IUD. And I actually think that the Nexplanon implants now last years instead of months, if I'm remembering correctly. And finally, the IUD, which stands for an intrauterine device. It looks like a little T, and it goes up into the uterus, and it prevents pregnancy both physically by being there, and then some of them do have hormones built into them also that work with pregnancy production. But just the physical presence of them there. The copper ones, copper weakens the sperm. There's a whole scientific explanation for that, but copper weakens the sperm and makes it where the sperm cannot get to the egg. And then also, again, some of them have hormones in them that are being released that are acting in a similar way as the other hormonal contraceptives. The intravaginal methods are the diaphragm, the cervical cap, and the sponge. Diaphragm and cervical cap are both intended to be used also with a spermicide. These are both items that sit inside the vaginal canal and are meant to physically block sperm from being able to go up through the cervix, which obviously is going to prevent fertilization. But to prevent any of them from sneaking by, because obviously sperm are teeny, teeny, tiny, you do also want to use a spermicide along with those. And the sponge looks like a little oval sponge that is basically filled with spermicide that goes up in there as well. Rhythm methods are fairly controversial. That's the natural family planning, where the one who is ovulating is tracking that ovulation. And so you know when you can have sex and when to avoid having sex. This is basically the reverse of what a lot of people do when they're intentionally trying to get pregnant. You know your fertile days, and you're either intentionally hitting those fertile days or you're intentionally avoiding them. There's 3 key ways for doing this. One is to simply track menstruation on a calendar, and that'll kind of let you know when ovulation is occurring. The other one is called the BBT method, or the basal body temperature method. And that one is where you take your temperature every day, because there is a slight temperature spike right around ovulation. And the last one is the cervical mucus method. And that is that many individuals notice that their cervical mucus changes texture right around the time of ovulation. So you can track it that way as well. These are not super effective during teenage years. Early 20s, they're also not totally effective, just because there tends to be much more variation in the ovulatory windows the younger that you are. Once you get into your later 20s and in your 30s, these methods do tend to be more predictable and more accurate, but stress can change it. Significant weight changes, significant changes to how frequently you're exercising. There's all sorts of things that can impact ovulation. So that would be something to make sure that you're dialoguing with your healthcare provider about if you're going to rely on that. This is one that a lot of individuals who either have health problems that prevent them from being able to use hormones, or if they have religious beliefs that put some of those hormonal methods off limits. And then finally, the permanent methods, which is kind of a misnomer now because they can be reversed, but we still like to think of them as permanent. And that's a vasectomy and a tubal ligation. Vasectomy is cutting tubes, specifically the vas deferens, within like the testicular area, and then tubal ligation is cutting the tubes that connect the ovaries to the uterus. So obviously, if you've disrupted that pathway, things aren't going to be happening. I will have that be the end of part 2 because I want this to be its own video because, like I said, the idea of is emergency contraceptive abortion is a huge soapbox of mine. So I'm going to have this be its own video. So that's going to be the end of part 2, and then click through for part 3 about is emergency contraception the same as abortion? Where is my stop button?